Our next guests are chiropractors who believe that health is a journey, not a destination. Dr. Luigi Deruba and Dr. Scott Aracchio are from Central Connecticut Chiropractic of Cheshire, and they're here today. Guys, welcome to the show.
Thank you for having us.
Great to have you.
Thank you for having us.
Now, I'm sure that there are a number of reasons, but let's talk about some of the top reasons why a lot of people are coming in to see a chiropractor.
Main reasons are first to stay healthy, and a lot of conditions like, example, asthma and allergies, children with bedwetting problems, ear infections, pregnant mommies, to have an easier delivery.
Really?
It's phenomenal.
And you are addressing pregnant moms?
Oh, yes.
And is that technically, I mean, is that usually pretty safe?
Very safe. It eases up the labor process, and at the same time, during the pregnancy, it makes the development of the baby much better.
And I'm sure, Dr. Scott, neck, back, and pain has got to be one of the more popular reasons as well.
The usual symptoms as to why somebody comes in, leading to other health concerns, though.
Okay, good to know. Let's also talk about stress relief. You say that getting an adjustment can kind of relieve stress. That's true?
Oh, for sure. When your spine is balanced, it takes a lot of the stress away from the muscles being tense on one side compared to the other.
Okay.
So you'll notice that, especially with women who carry pocketbooks and phones, it causes a lot of strain and stress to the neck region. So when they get adjusted, it relieves all that.
So what are you all as doctors, as chiropractors looking? I mean, when I come in for my initial visit, are you going to be assessing, and where are you going to be assessing my back?
Well, we'll be assessing it with a postural exam.
Okay.
We'll also do some diagnostic testing, as we could show them on the screen, which is a EMG, which is almost like a high-tech stethoscope of the nervous system.
And it kind of shows a good back and a bad back,
yes,
basically?
the one on the left shows the good spinal readings, and the one on the right shows some abnormal findings that we need to address.
And we talked earlier, not only are you adjusting adults, but it's okay and safe to adjust young kids?
Absolutely.
Okay, so we have a model. Daniela, if you will come on in here, please. Look at there, you're smiling away. And let's talk a little bit about this, if you will. Why is it safe to adjust a child?
Well, we want to make sure that we address the issues right from birth process. The birth process itself is the most traumatic a child will ever experience. So we want to make sure that that spine is balanced after delivery.
Okay.
So we'll check children from birth on. And then afterwards, children who may have some health issues, an example, allergies, asthma, ear infections, we know that the upper neck region, when it's out of alignment, it affects the nerve structures which control your ears, sinuses. And so when we're adjusting those areas, it allows the body to function better in those areas, eliminating the conditions.
So Dr. Scott, can you, if you will you walk us through kind of what you would be looking at? If she were to come into you right now, just kind of walk us through what you're doing right now.
Well, right now I'm doing a leg check, okay? It shows pelvic discrepancy or postural imbalances.
Okay.
Okay, and then I had already assessed for range of motion just in the neck region, the cervical region. And now what I'm going to do is I'm actually going to palpate the spine to check to see where those subluxations might be existing within the spine itself.
Which is English for what?
Misalignments within the spine.
Gotcha, okay.
And we also utilize X-ray, which helps us, just in case if we see a child that may have much more of a discrepancy in their spine, we may determine to take an X-ray to see if there's a very severe curvature, which we all know is called scoliosis.
Okay.
So we can also help scoliosis reverse itself.
But Dr. Luigi, how do you know that your child needs to come in? I mean, should you be taking a more proactive choice and move and just kind of bringing them in anyways? Or?
Correct, Desiree. It's very important that parents start taking a very proactive choice. Not to wait till a child has a health problem. Start going to a chiropractor, getting them examined, and determine if they have a health problem, a spinal problem, so they can get addressed immediately.
Okay.
All right. We have children in our office are being brought on a regular basis that parents are saying, well, we're finding out that, getting your spine adjusted actually keeps children healthy. We want to do that for our kid.
Wow. All right. And Dr. Scott, you're shaking your head saying absolutely.
Absolutely, yes. The minute you relieve the stress off of the nervous system, it's amazing what the body can do. And when you have children that come in, they see the best results because their spine isn't used to being a certain way for so long like in an adult.
And let's talk about what kind of questions should you be asking if someone's going to watch this segment today and they're thinking to themselves, I think I might need an alignment, but I'm not sure. How do you know? And then what are the best questions to ask a chiropractor?
Okay. The number one thing is to make sure that you're very thorough with your history to the doctor.
Okay.
So the doctor can develop a great rapport with you and understanding where you're coming from lifestyle-wise. That's number one. Number two, determining what type of care you would like to receive. If you want just pain relief, if you want corrective care, if you want lifestyle choice changes. A lot of doctors work with, not just in regards to making sure that your body's healthy, but we can work with nutritional factors, physical exercise issues, and also some things that are for family.
All right, good to know. And Dr. Scott, would you say that people that are coming in, I mean, this isn't something that you're going to be fixed overnight, meaning if you have an issue with your back, it's going to take more than one visit, or what do you think?
Well, that would be determined on the initial visit when we do the examination. Again, like Dr. Drew mentioned, it takes a detailed history and postural exam, and then we use the scanning technique and possibly x-rays as well to determine that.
Good to know. Let's talk a little bit about your event coming up. It's Girls Night Out. You two will be there. What can folks expect? What are you going to do for the ladies? Right, ladies?
We're going to have a very large booth, and there's going to be a multitude of chiropractors there answering questions, which is the #1 thing, but we'll also be scanning people there, what we call a postural screening. It's like a brief exam to determine if you need to see a chiropractor or not.
Okay.
That's #1. We'll have educational material there. Also, we'll be handing out water bottles to people who do get screened at the same time.
That's good for a good run.
Right, good run. We want to make sure there are other issues besides just chiropractic. You know, water is very important.
Yes, absolutely. All right, sounds good. Danielle, you can get on up and show your pretty face. She's been laying down there just so wonderfully. We appreciate you being our model. Let's put the information on the screen. If you're watching right now, you're going to be at the upcoming event, again, taking place April 22nd. It's a fun girls' night out at the Oakdale Theater in Wallingford. Again, if you missed that, you can come to our website. And guys, the website again for you is www.cheshirechiropractic.com.
Yes, and then you could also log on and at the same time sign up for our health newsletter, which we send out bi-weekly.
I like that. Is it free?
Yes, it is.
Okay, that's the most important. I just put them on the spot, everybody. I'm trying to get you something for free. Thank you so very much.